blood pressure that could help people before it becomes a problem. Marissa sat down with Dr. Barry Ramo to find out how to catch it before it's too late.
Dr. Ramo, my family has a history of high blood pressure. Could I have high blood pressure?
Well, do you think you have any symptoms?
Honestly, I can't remember what the symptoms are.
Well, in fact, you're right. There are no symptoms for high blood pressure.
Okay, well, good. What a trick question. Thanks, Dr. Ramo.
A lot of my patients come in and they say, I've been having headaches, and it must be that my blood pressure's up. In fact, high blood pressure rarely causes symptoms. It is a silent disease. We think about 60 million people have high blood pressure, and in fact, the societies that really look at this have decided that high blood pressure has several phases. One is that there's real high blood pressure, but the other is a phase called pre-hypertension.
Ah, so what is pre-hypertension?
Well, pre-hypertension is ideally what you'd like is a blood pressure of 120/80.
Sure.
Pre-hypertension is 120 to 139, and above 139, 140 and above is real hypertension.
Right.
Now, pre-hypertension is a concern because people who have pre-hypertension are at risk for developing full-blown hypertension. The reason you don't want that, obviously, is because it leads to heart disease and stroke and kidney failure. So it's very important that people recognize that they have it. But as you said,
right,
you don't have any symptoms, and people with high blood pressure don't have any symptoms, so they need to get checked.
Okay, so is that what you're supposed to do? What can be done for it?
Well, a lot of things. Number one is when you go to the doctor, make sure that they tell you what your blood pressure is.
Okay.
You ought to have it checked at least once a year, and that's fine if your blood pressure is always normal. But what I tell my patients, if they have high blood pressure, they ought to buy a blood pressure cuff. You can get one for $60 at the drugstore. And check your blood pressure a couple times a day to make sure that it's possibly in the right range.
All right, to prevent the pre-hypertension.